for a long time, we really did not have an option. Heparin, warfarin was the standard, and I think with newer data on the newer anticoagulants, including the 10A inhibitors, are giving us a choice. I mean, this study here tells us of a non-inferiority of a low molecular weight heparin with warfarin versus this 10A inhibitor, and looks like it is non-inferior with conceivably small advantages. One, looking at individuals with indirect evidence of larger pulmonary embolism, that there was a slight benefit, maybe lesser bleeding using this approach. So therefore, it's giving us an option to consider in patients with classic deep venous thrombosis with or without pulmonary embolism. And the choice of one versus another, always debatable, but I think some of the factors are, besides difficulty in compliance, is effect of diet, depending on how good the control is with warfarin versus erratic control, effect of diet, bleeding tendencies, etc., and the frequency of blood draws versus a medication that has less of those interferences. And ultimately, obviously, these are newer drugs, so therefore cost is a factor. And hopefully that cost differential over time will get less, and people as well as physicians would be more comfortable with the newer agents. So it takes time for an uptake of such newer drugs, but I think you will see this as certainly a solid option going forward.
And talking about uptake, so if you could characterize the extent to which there's been penetration of the new oral anticoagulants in the U.S. in treatment of VTE, how has that gone so far?
I think it's increasing, but remember the data and even FDA approval was just recent, relatively recent. So the uptake is going to be slower. If you take the AFib comparison, if you will, since the first drug, dabigatran was introduced in addition to the newer ones, now we have data telling us that over the past few years, about 11% crossover from warfarin to the newer anticoagulants. So you will see a small effect, gradual effect probably, of a change in practice with the newer anticoagulants compared to warfarin.